What is up, guys? Welcome back to the channel and welcome back to Mateo Family Vibes. Now, have you ever wondered what happens when you get sick in the Philippines? Where do you go? Do you go to hospital? Do you go to, a clinic or something? Have you ever thought about that? Well, I got to find out. So a couple weeks ago, came down with a really bad cough, cold, sinus issues, and so instead of kind of letting it play out, I figured, what the heck, let's go ahead and find out what it's going to cost, and most importantly, how it's dealt with, right? So as most of you know, if you don't know, I live in Mandaluyong City, right? Beautiful Mandaluyong, and there is a hospital probably like 5 minutes from here. As a matter of fact, it's like right here. It's called a VRP Medical Center. Great hospital. Her daughter was born there. But I didn't want to go to VRP. I said, you know what? Let's go to probably, I would say, what would probably be the most expensive option if you were to be here in Metro Manila. So I said, hey, let's go to St. Luke's Urgent Care. So in front of the St. Luke's BGC hospital, there is essentially a urgent care center that you can just walk up and go to if if something is wrong. So I figured, what a great way to find out, first of all, the cost, so that way up front. And there is a cost, by the way, a flat cost for seeing a doctor there, but most importantly, I think the experience, honestly, and what you get for going to what you would presumably say is probably one of the best hospitals in the entire country. So what do you get? How do you treat it? And most importantly, how much does it actually cost? So let's talk about how to get there first. Obviously, Grab, right? So Grab from here to that specific hospital ran about, I want to say, 250 pesos or so, or about $5 if you're in the US. Now, as far as getting there, and once you get there, what happens? So essentially, it is just like what we call in the US, just like an urgent care clinic is what it is. The only difference is that it's connected to the hospital. And so essentially any kind of major testing is literally done in the hospital. They send you to the hospital. So I got there, got signed in, and it took about maybe 15, 20 minutes or so for me to actually see the doctor. Essentially took my vitals and asked me what was wrong. I gave him the whole spiel, what was happening, and she recommended two things. So number one, she recommended a chest x-ray, and number two, she recommended was a test, like a flu COVID test, essentially. So those two things is what she recommended, and so I obliged and went ahead and got me the script to do the test, and I went on to the hospital. Basically got the chest x-ray done first, and then after that I went ahead and went to get the COVID flu swab done test. I got to be honest with you, having that COVID flu testing kind of brought me back memories of 2020, when all the crazy stuff was going on and you needed to get tested to go anywhere and stuff like that. Not the great experience with the test, because obviously you stick a big thing in your nose all the way to the back of your nose, and it just felt really uncomfortable, but it is what it is. Now, the interesting part about it was that typically she told me we would get the results typically for the x-ray and for the COVID flu test within about maximum 2 hours, right? So 15 minutes once I got there to actually see a doctor, maybe another 5 minutes before she gave me the script. And then I headed off to the hospital to get the chest x-ray first and then the COVID test second. Chest x-ray, went to the x-ray service area in the hospital. Literally, I mean, as soon as I walked in, within 2 minutes, I was taken back to the x-ray machine, waited maybe another 5 minutes or so, got my x-ray done, and then went off to get the test for COVID flu test. Went and got the COVID flu test. That took, I mean, the test itself was literally 5 minutes or less. I did have to wait maybe about another 15 minutes outside because there were other people there also getting the same test, I guess, done. Now, interesting thing is that once I got the test done, once I got the flu, COVID test done or whatnots, and they're like, okay, you can go back to the urgent care and we'll send the results whenever they're ready. By the time I got to urgent care, back to urgent care, the chest x-ray had already come back. So as soon as I walked in, I waited, I want to say maybe another 10 minutes or so. And then the doctor came back, called my name, and she, said, hey, here's the results of the chest x-ray, which was clear, which is good. So I wasn't, having any kind of pneumonia or, any kind of weird stuff like that, which is awesome. Then she's like, just have a seat back down, and as soon as your COVID test comes back, then we can, kind of give you the prescriptions on what it is, and then you can kind of, be on your way. The waiting around part, honestly, for the COVID test is honestly what took the longest amount of time. It took, I want to say, about another 45 minutes to an hour and 10 minutes to get the COVID test back. So I was there essentially for the entire duration. It took longer to get the results of the COVID test than if you take out that COVID test and the rest of the time that I was there. So COVID test came back after 45 minutes to about an hour or so. They're like, hey, everything's negative, which is great. So here are some prescriptions, for your throat, your cough, and everything else like that. So I ended up getting, let's say two prescriptions from the doctor, and that's it. Went on my way and went to the pharmacy, got the prescriptions, and then made it back home. So total time that I spent at the actual urgent care place is, I want to say, probably 2 hours max. About 2 hours max. About 2 hours max. Coming back home, the trip coming back home, I think it was like 350 pesos or something on the Grab, because it was obviously more towards the afternoon traffic, so the rate was obviously higher. So what did all of this cost? Because at the end of the day, right, you're going to have, there's a cost on the receipt that you could see where it's just a flat rate for actually seeing a doctor there. So let me give you that. And if I can, I'm gonna try to put it up on the screen so you can see it. But essentially the flat rate for, to see urgent care, right, the ER diagnostic urgent care fee, essentially is 3,000 pesos or about $60, okay? The chest x-ray was 1,800 pesos, and the rapid flu COVID test was 1,300 pesos. So in total, just to see the doctor and essentially get those two tests done, total was 6,189 pesos, or about $111.50. So that's how much it cost to go to urgent care, see a doctor, get two tests done, a chest x-ray, a COVID-19 flu test, and then get your prescriptions. It took about 2 hours total, and it cost about 6,000 pesos, or about $111. Now, This is, of course, without insurance. This is literally just walking up, no appointment, nothing. You just literally walk up and say, hey, I'm sick, I need to see a doctor. So, what is the lesson learned from this? Well, I know that if you were to, at least before I left the US, if you were to go to an urgent care, most of the time you need an appointment. And if you did not have if you didn't have insurance, essentially, the appointment just to see a doctor was about, I want to say about $120 or so. Again, this is before I left, so if things have changed, then they've changed. But to, how much they charge for x-rays and how much would they charge for, a COVID test, I don't know. In the US, if you're in the US, let me know in the comments below if you've recently had that without insurance. But for here in the Philippines, for someone, anybody, it could be a foreigner, it could be, a Filipino, going to urgent care at probably the best hospital in the entire country, getting a quick diagnosis, and getting, tests done and all that stuff cost me $111.50. In America, I guarantee you that would have been a heck of a lot more than $111.50. Now, total cost with the prescriptions. So I got 2 prescriptions during that visit, and the total for the prescriptions themselves, because it was only a 10-day prescription. So basically she wanted me to take the pills for about 10 days. If I wasn't feeling better after that, she told me to come back and we could see a specialist, about whatever what other, tests we could run to find out what's really going on. So obviously, as you can see, feel better, feel perfectly fine now. It did clear up with the medicines that they gave me. The medicines themselves cost about 2,000 pesos, an additional 2,000 pesos, or about $40. Okay, so essentially for about $150, okay, I was able to go to probably one of the best hospitals in the whole country, get seen by an actual doctor within 2 hours, get all my prescriptions, get tested, all that stuff within a 2-hour range. And yeah, I think it would have been a lot cheaper as far as like the fees go, and possibly even the tests, I don't know. But I think it could have been a lot cheaper if I would have went to the different hospital here, VRP. But I wanted to kind of see what is the worst case scenario, right? If I needed to go to, a really good hospital like St. Luke's BGC. Of how much it would actually cost. And we got the answer. Will I go there again, or would I recommend anybody to go there again? Yes, I would recommend somebody to go there again. And was it worth the 6,000 pesos? I think so, because at the end of the day, it saved me a lot of time, and that's at the end of the day, that's something that I cannot get back, is my time. So for literally 2 hours, I was in and out of there. Really nice doctors, nurses, just everything. So I can't say enough good things about my experience at St. Luke's Urgent Care Center. I'm sure if I would have went to VRP or any of the other private hospitals that are around where I live, I'm sure it would have been the same experience, just probably cheaper. But again, just wanted to give some different insight for myself, really, because I had never gone to that urgent care before, so didn't know what to expect. And so now I do, moving forward. And to also give you guys something that's, give you guys some perspective on actual healthcare for someone that lives here full time in the Philippines, in Metro Manila, basically the most expensive city that you can live in the Philippines. What's the cost for going to urgent care? Well, in this video, you got the cost for going to urgent care. So hopefully this video helped, guys. Let me know in the comments below. If you're in America, what have you paid for going to urgent care. Again, I haven't been to America in many years, so I don't know what the updated prices are and things of that nature. So if you could let me know in the comments below, I'm very curious to know what the cost is for maybe a chest x-ray or a COVID test or flu test or something of that nature. And really just to see what is the fee for urgent care to see a doctor there. All right. As always, guys, please make sure to like, share, subscribe to content, and we will see you in the next one. Peace.